The 21st Century Cures is a nonpartisan initiative to examine and improve the discovery, development, and delivery cycle. There are significant impediments at each stage of the cycle, in large part because of an outdated and outmoded regulatory structure. The 21st Century Initiative is giving us an opportunity to address some of the structural barriers to new cures and treatments. This is about the people who need more efficient and effective treatments more quickly, but do not have access to them. I'm proud to have a number of provisions in this legislation. One is the OPEN Act, the Orphan Products Extension Now Act, introduced with my friend Representative Butterfield. Over 130 million Americans suffer from a chronic condition, and nearly 1 in 10 Americans suffer from a rare disease. Of the 7,000 rare diseases, 95% have no FDA-approved cure. That is staggering. The OPEN Act would provide a 6-month brand name exclusivity extension for companies that find a way for an existing drug to treat a rare disease. This incentivizes companies to do the trials for rare diseases so that the mainstream drugs would also be approved for rare conditions. Last August, I held a 21st Century Cures Roundtable in my district. Ashley Pike, a constituent and participant, talked about how important it is to the rare disease community to incentivize the repurposing of drugs. A second provision is based on a bill I introduced with my friend Representative Lujan, the Medicare Patient Safety and Drug Abuse Prevention Act, which will establish a drug management program. This program will prevent at-risk beneficiaries from abusing controlled substances and will monitor the prescribing and dispensing of controlled substances for at-risk beneficiaries. This prevents prescription drug abuse and drug diversion. It is a common-sense measure utilized by private industry, TRICARE, and state Medicaid programs. Another provision of mine would provide seniors with transparency and Medicare Part A and B. It would allow seniors to better identify the out-of-pocket costs they might face for a given treatment or service and the site of service that is right for them and their budgets. Also, I'm glad we have language dealing with the FDA and combination products. This is an important issue that needs to be addressed. In FDA's testimony during the legislative hearing, they admitted that the process could be improved. The combination product provision in cures is a good start. Finally, I ask unanimous consent to insert these 2 letters of support for the OPEN Act from 150 patient advocacy groups into the record. Thank you, Mr. Chairman. I appreciate it. I yield back.